So Oncotype DX assists a man's decision in active surveillance in one of several ways. First of all, when deciding on active surveillance, you have to make a decision based on several factors. One is how aggressive the prostate cancer you have is, and that's based on something called the Gleason score, and you'll hear that name if you've been diagnosed with prostate cancer. Another factor is your PSA and how much of the biopsy is positive. Now, many cancers are non-aggressive. Many prostate cancers are not going to cause harm to a man in his lifetime, but many do. And so those cancers that we deem low risk or non-aggressive can actually be watched and not treated, at least not immediately. So some men will remain non-aggressive for the rest of their life and may never need treatment. But some men may start out with a low risk, non-aggressive prostate cancer, and then it might become aggressive, and that's why it's important to do surveillance, to keep a close eye on your prostate cancer. And that's something your urologist would do, but it's not watchful waiting. It's not that you're not doing anything. You are actively watching a cancer like this. Oncotype DX is a genomic test, and what it does is it actually looks at the genetic information from your biopsy, from the actual cancer cells, and can help differentiate those low-risk, non-aggressive cancers from those aggressive, more worrisome cancers. And this is sort of the first time we've had this type of genetic information available to us in prostate cancer.
Some prostate cancers are high risk, aggressive, and more likely to spread. Others are low risk, least likely to have bad outcomes. The biopsy says cancer, but current diagnostic tools provide limited information about how aggressive a man's individual disease is. So most men decide to treat prostate cancer immediately. Once treated, many men experience serious long-term side effects, like incontinence and sexual impotence. Immediate treatment isn't always needed, but right now a man can't be sure if his cancer is the kind that is likely to require treatment or if he's okay to wait for now. What if there was a test that could determine how aggressive prostate cancer is? Genomic Health is developing a new test to do just that. By reviewing the underlying biology of the tumor and using genes from multiple biologic pathways, the test can predict the aggressiveness of prostate cancer when diagnosed, allowing a man to make a more informed treatment decision with confidence, taking care of himself with more information and greater peace of mind.